March marks 2 years since South Africa reported its first COVID-19 case and went under alert level 5 of the lockdown, with 48% of the adult population vaccinated now and daily COVID-19 numbers being relatively low. Is South Africa ready to drop COVID-19 restrictions? For more on this, we are joined now by Health Department Acting Director General, Dr. Nicholas Crisp. Dr. Crisp, good evening and thank you very much for your time. The last time the presidency spoke about the question of restrictions due to COVID-19, they were saying their work is quite advanced, wherein the regulations would now be really placed at the Department of Health, and we would be able to move out of the state of national disaster. I had a chat with the minister on that work, and he also indicated that work was quite at an advanced stage. Are we there yet? That's the question.
Yeah, good evening and good evening to the viewers. So certainly there's been a lot of progress made. It's been a massive roller coaster ride for 2 years. But we are at a stage now where the President has asked all departments to look at their regulations and make sure that the necessary regulations are either in place or almost in place, so that a decision can be taken by Cabinet to whether to drop the application of the Disaster Act.
Yeah. There's been some advice from some experts. I don't know what the National Command Council is saying around, for example, dropping the use of masks. Is that something that is on the cards?
Well, I mean, there's masks and masks. So the one thing we need to say is Corona is not over, far from over. We know that we are going to get a fifth wave. It's just a matter of trying to predict when, and we can't anticipate what the variant will look like or how it will behave. So what we do hope for is a variant similar to what we have now, and that the pattern of winding down in virulence will continue. But we've learned the hard way not to jump to any conclusions with COVID. So some measure of caution is required, and certainly we are not recommending yet dropping masks indoors, but masks outdoors and where there's good ventilation, you're probably a bit safer. The trouble is that we are only 48% of the population is vaccinated, and countries who have dropped these regulations and who are opening up their economies and their entertainment are all sitting around 90% vaccinated. So we have a lot of work to do, and if we are not all protected, we may err on the side of caution rather than proceeding with dropping all of these measures.
Yeah. Which protocols are to remain? I mean, for example, we've done away with things like contact tracing in particular. We've done away with things like extended periods of isolation and so on and so forth. And I mean, even at schools, we've adjusted the social distancing regulation to quite an extreme extent to be able to accommodate more students. Which ones will remain? Which ones will fall away?
Well, we'll have to wait and see what the Corona Command Council says, and then they recommend it to the National Committee, which has all the premiers in, and then it goes to Cabinet. So I certainly won't preempt what is going to be the outcome of such a meeting. The question is whether we will need the National Disaster Act to put those kinds of measures in place, and if the next wave or subsequent waves grabs us and does horrible things to our society again, will we need to revert to the National Disaster Act, or will we have other regulations in place? So right now, we don't have many restrictions at all on us, and I'm not sure that we need to be in too much of a hurry to abandon everything.
Right. As far as the Department of Health X is concerned, there's been, as you put it, this concern that should the situation change very quickly, I mean, do we revert to the National Disaster Act, or will we be at a position where we've put enough within the Health Act to be able, for example, to put the emergency measures that are needed in terms of procuring of PPEs and all sorts of other things that we saw we needed during the height of the pandemic?
So we administer quite a lot of legislation in the Health Department, and all acts have regulations, and it's the regulations that get amended from time to time. Acts are only amended or abolished or created in Parliament. And it can take years to get an act through Parliament. So what we have to do is hope that there's sufficient provision for the necessary regulations in all the acts that are going to be applicable and might need to be used after the end of the Disaster Act. Now, in the case of health, the one that we have to be the most concerned about is the infectious diseases regulation. And there are some concerns, or there have been concerns over this period of preparation, that the current way in which the Act is written does not allow for the full spectrum of regulations that one might otherwise need in a pandemic situation. It caters for outbreaks very, very adequately, and that's pretty much what we've had up to now when we need to isolate individuals. But for the isolation of whole communities, towns, provinces, and such as we saw in the lockdown, there's no clarity on whether any existing legislation in health or anywhere else other than the Disaster Act would enable that. Hopefully we don't need to use it, but we need to be prepared.
Yeah. Now, the various government departments, including the Department of Labor, including yourself, the Department of Health, you've been walking a tightrope when it comes to this question of vaccine mandates, and there have been lots of talks back and forth. Are we at a point where we are going to make a decision now on whether or not it is going to be mandatory for people to be vaccinated, at least to access areas of work, institutions of higher learning, and maybe even some sporting facilities and some recreational areas?
In those places, there are already mandates. Most higher education institutions, certainly the bigger universities, already have a vaccine mandate. That's not in the Health Act. That is part of the Occupational Health Act, not the National Health Act. And there are provisions in the Labor Relations Act as well and elsewhere where employers have to be responsible and look after all their workers, not just a few, and they have to make sure that workplaces are safe. So there are various places in our legislation where there are provisions which allow for this kind of requirement. And it's not the first time it's been done. This might just be on a wider scale. So mandating or requiring people to be vaccinated, to be in certain work situations, certain recreation situations, and spaces where it might be dangerous to be as large groups of people congregating. There are already provisions in the legislation, and many people have used those, and there have been challenges in court, all of which have allowed mandating of vaccination. It's highly unlikely that government will make it compulsory, in other words, to force everybody to have a vaccination to do anything. That has been clear right from the word go.
But are there any policies? I know what you're saying, the onus has really been put on the private companies themselves to decide which policies they will put in place. Are there any policies that are going to come from government on vaccine mandates?
No, it's all about employers. There's no indication, and has never been an indication, that government is going to make it mandatory that everybody in society must be vaccinated. That would be a contestable decision to make. What one needs is to be discriminate about individuals in individual workspaces where you make sure that in that workplace, the people who congregate are safe from one another. We have had conditions all over in the past where, for instance, you can't smoke and you can't do various other things in certain environments. And this is really no different from that. So there's not likely to be a law that says everybody must force all workers or all people that enter A, B, or C facility to vaccinate. What there will be is restrictions that say you can't cram crowds into a space unless they're vaccinated. And if everybody who enters into some of these more risky spaces for transmission of disease, then the number of people that you can get into that space that may be allowed will be more. But to force, you're asking me about compulsory, not mandatory vaccination, and there's a big difference. There won't be compulsory vaccination.
Now, DG, there's been a lot of talk around these 100,000 expiring vaccines, and the criticism is that the department lacks the creativity to be able to communicate effectively and get particularly the cohort of young people that you would like to see getting vaccinated, actually taking up the vaccines. Had there been some bout of creativity blowing swiftly at the department to help us to get those 100,000 doses out into the arms of young people?
That's an interesting one. But first, just a correction. I'm not the acting DG. Fortunately, the DG is firmly in his post, and I'm the Deputy Director General for National Health Insurance. But just in response to the question, so we have in the country at the moment more than 25 million doses of vaccine. We've administered 32 million doses of vaccine. And we have programs that have been running for a long time now. So we know that we are able to vaccinate 250,000 people every day. And between the private sector and ourselves, we have kept and maintained that capability. So we have the vaccines, we have the staff, we have the sites, we have a whole range of various ways of reaching people, in reminding people with WhatsApps and, SMSs and with other social media. And we have every single radio and TV station in the country assisting and supporting. So there are many, many mechanisms. Various other departments have been in touch with religious leaders, traditional leaders, political leaders, and so forth to get them to be motivated. None of that is the core business of the Department of Health, but obviously we are part of the government. And what we would like to see is not only a whole of government approach, but a whole of society approach. So it is true that we have around 100,000 doses of vaccine out of the nearly 60 million doses that we either have yet to administer or have already administered that will expire on the 31st of March. Now, the risk of distributing those vaccines to the periphery is that we put pressure on the sites who are then unable to use the vaccine, and then they have to destroy it in the periphery. And that becomes a burden for them. It's more expensive and it's more difficult to monitor. So what we would rather do is take the 400,000 doses that expire at the end of April and make those available into the supply chain now. And that's what we did this past week. And all of the doses that expire in April have been ordered and distributed. Now we start to work on May, and we are busy working on June and July expiring doses already. So we do need to increase the tempo and use our vaccines. This has cost us a lot of money as taxpayers, and we are really disappointed that not more people realize that they need to protect themselves by coming for vaccination. So really, I want to appeal to people. COVID is not over. It remains dangerous, and if you are one of the unlucky ones who gets really sick and ends up in hospital or dying, your chances of being that person is far higher if you are not vaccinated.
Deputy Director General of the Department of Health there, Dr. Nicholas Crisp. Appreciate your time, and thank you very much for joining us tonight.